a year old here with Crohn disease and pulmonary nodule. Presentation of the case. The patient presented abdominal pain, diarrhea, weight loss, and fever, lactate deficiency, ulcer, acute gastritis, and granuloma in the duodenal bulb, and chronic active colitis.
Use of OTSC in forest 1B bleeding from a peptic duodenal ulcer in a 77-year-old male patient. The ulcer is located at the interior wall of the duodenal bulb.
The patient is under NSAID therapy and negative for H. pylori. After careful location of the bleeding site, an 11-6 tip is applied using suction of the endoscope. Re-gastroscopy for a non-related pathology 1.5 years after the OTSC placement demonstrates the OTSC clipping site. The clip had fallen off.
Different diagnosis, gastroenterology perspective, infection, malignant tumor, pulmonary disease association with inflammatory bowel disease. Pulmonary perspective, pulmonary diffusion associated with inflammatory bowel disease, pulmonary Crohn disease, other cause of pulmonary abnormality. Pathology discussion. A thoracoscopic lung biopsy was performed. The biopsy specimen contained a single subfield. The lymphatic granuloma is characteristic of granulomatosis with polyangiitis, the presence of microasset with scattered nodules and numerous eosinophils. Discretion of management. This patient have necrobiotic nodule causing cold, pruritic chest pain, dyspnea of hernias, a pulmonary function abnormality. The maintenance of treatment is prednisone. Anatomical diagnosis: pulmonary necrosis, granulomas with future resembling granulomatosis with polyangiitis in a patient with Crohn disease.
What is Crohn's disease?
What is
Crohn's disease is a chronic condition characterized by inflammation in the gastrointestinal or GI tract, which is also known as the digestive tract. Since Crohn's disease is a chronic illness, it is persistent and will be present throughout life. However, patients and physicians can work together to manage the symptoms of this disease. The GI tract includes the mouth, esophagus, stomach, small intestine, large intestine, and anal region. Crohn's disease can affect any part of the GI tract, but the most common location is the last part of the small intestine, which is called the ileum, and the first portion of the colon, which is also referred to as the large intestine. Current thinking is that Crohn's disease is a genetic disease, caused by abnormal regulation of the immune system.
Is a genetic disease.
The GI tract is frequently confronted with bacteria from our diet and environment.
GI tract is frequently confronted
Many
with
factors can
bacteria from our
contribute to a
diet and
person's risk of
environment.
having Crohn's disease, but most
Many
can be thought
factors
of
can
in three
contribute to a
categories:
person's risk of having
genetic
Crohn's disease,
predisposition,
but most can be thought of in
environmental
three
factors,
categories.
and a
Genetic
dysregulated
predisposition,
immune response in the GI
environmental
tract, which
factors,
causes
and a
inflammation.
dysregulated immune response in the GI
Environmental
tract,
factors that
which
may
causes
contribute to Crohn's
inflammation.
disease include infections,
Environmental factors
smoking,
that may
and
contribute to
taking
Crohn's disease
antibiotics
include
or anti-inflammatory
infections,
drugs known as
smoking,
non-steroidal
and taking
anti-inflammatory
antibiotics
drugs,
or anti-inflammatory
NSAIDs.
drugs known as
One way
non-steroidal
that the body can
anti-inflammatory
protect
drugs,
against potential
or
bacterial
NSAIDs.
threats is with
One
inflammation.
way that the body can
We are
protect against
familiar
potential
with how
bacterial
inflammation
threats
looks
is
on
with
the outside of
inflammation.
the body. For
We
example,
are
when you have a
familiar with
scrape
how
or a cut.
inflammation looks on the outside of the body.
That
For
scrape or
example,
cut
when you have a
becomes
scrape
red
or
and
a cut.
inflamed as a result of the immune system
That
trying to get
scrape or
rid of
cut
any
becomes
bacteria
red
and
and
viruses
inflamed
that are
as a
in the
result of
wound.
the immune system trying to
After a
get rid
few
of any
days, when the
bacteria
immune
and
system has
viruses
finished
that are
its
in the
job,
wound.
it turns off,
After
so
a
the
few
redness
days,
and
when the
inflammation
immune system has
disappear.
finished its job, it turns
In
off,
Crohn's disease,
so the redness and
inflammation,
inflammation disappear.
ulcers, appear within the
In
GI
Crohn's
tract,
disease,
and the immune system
inflammation,
works to bacteria
ulcers,
and viruses
appear
in the
within
same
GI
way as
tract,
with a cut
and
on the
immune
surface
system
of the
works
skin.
to combat the bacteria and
However,
viruses in
the
the same
difference
way
is
as
that
with
the
a
immune
cut on the
system
surface
is
of the
not
skin.
able to turn itself off after it has
However,
gotten rid of
the
the
difference
bacteria or
is that the immune
virus,
system
so the
is not
ulcers
able to
remain
turn
until
itself
they are
off
treated with
after it has
medicine
gotten
or
rid of the
surgery.
bacteria or virus.
This
So the
chronic
ulcers remain
inflammation
until
is
they are
what causes
treated
the
with
symptoms
medicine
of
or
Crohn's
surgery.
disease.
This
The
chronic
symptoms of Crohn's
inflammation
disease
is what
vary
causes the
depending on where
symptoms
the
of Crohn's
disease is
disease.
located and its severity.
The symptoms of Crohn's
This means
disease
that every
vary
patient
depending
with
on where
disease
the disease is
experiences the
located and
disease
its
differently.
severity.
Most
This means
patients
that
with
every
Crohn's
patient with
disease
Crohn's
have
disease
abdominal pain and
experiences the
diarrhea.
disease differently.
Other symptoms related
Most
to the
patients
GI
with Crohn's
tract can
disease
include
have abdominal
abdominal
pain and
tenderness,
diarrhea.
loss of appetite,
Other
weight
symptoms
loss,
related to the
fever,
GI tract can
fatigue,
include
rectal
abdominal
bleeding,
tenderness,
anal
loss
skin
of
tags,
appetite,
and
weight
ulcers.
loss, fever,
In
fatigue,
children,
rectal
Crohn's
bleeding,
disease may
anal
result
skin
in stunted
tags,
growth
and
and a
ulcers.
failure to thrive, even
In
if
children,
GI symptoms are
Crohn's
not
disease
present.
may result in stunted growth
In
and a
addition to
failure
symptoms
thrive,
involving the
even if GI symptoms are not present. In addition to symptoms involving the
GI tract, Crohn's disease can affect other parts of the body. Symptoms outside of the GI tract can
Crohn's
include
disease
joint
can
pain,
affect other parts
liver
of the body.
inflammation, osteoporosis,
Symptoms
skin
outside of the
problems,
GI tract
eye
can include
problems,
joint pain,
mouth ulcers,
liver
and
inflammation,
anemia.
osteoporosis,
Patients
skin
with
problems,
Crohn's disease
eye
should
problems,
expect to lead
mouth
normal
ulcers,
lives in
and
consultation
anemia.
with their healthcare providers.
Patients with Crohn's
The
disease
goal of the
should
healthcare
expect to
provider
lead normal
is to help
lives in
people manage
consultation with their
Crohn's
healthcare
disease
providers.
rather than having the disease.
The goal of the healthcare provider is to help people manage Crohn's disease rather than having the
Disease manage them.
disease manage them.
Conclusion: this uncommon fatal disease significant may predominate, although not universal. A large majority of patients with this disease have a history of chronic of recurrent such as pneumonia and accesses. None of those present to develop this type of pathology.